Hi, it's Q&A time. We're going to talk about kidney disease and why it's so important to be on the ball. 70% of kidney function can be lost by the time an animal is exhibiting obvious signs. Signs would be increased thirst and urination, sometimes vomiting and looking scruffy, so nothing too specific. But about 1% of dogs and 2 to 3% of cats in the population will have chronic kidney disease, and in cats, once they hit 15 years of age, 50% will have chronic kidney disease. So it is something really, really important to be aware of, that really impacts their quality of life, that we can do so much about if we catch them in the early stages of the disease. Early stages are 1 and 2. 3 and 4 are your advanced stages, and the treatment is going to be geared towards management. So the way we find out about kidney function impairment is by taking a urine sample and testing how the kidneys are filtering and concentrating the urine. Then we take blood tests. And if we're concerned about getting more information for a diagnosis, then we can move on to imaging and even taking biopsies of those kidneys. The more we do to help them in stages 1 and 2, the better we can keep them from progressing into 3 and 4. So we get a urine sample, we get a blood test done, and then once we know what stage we're at, we'll know whether it's appropriate to think about changing the diet. We can introduce medication. We have things like blood pressure to manage, excretion of protein into the urine, and making sure that the animal's comfortable. And one of the main signs is nausea and inappetence. So they will eat less and lose weight, which makes them really quite unhappy. And even though that's just a side effect, it has a very big impact on their quality of life. So bring them in twice a year at least, once they've hit 7, and we can have a chat and advise you in terms of what is appropriate for your individual. Lifestyle changes can be made to adapt. That's stupid. There are no lifestyle changes for kidney disease, really. Yeah. Treatment of kidney disease. Treatment of kidney disease consists in changing the diet and introducing
the local pigeon
and nausea mainly. I just hit my bottle and that distracted me too. I'm not a professional. Do you listening on me?
Of course.
Are you still filming?
Yes.
Oh my god.
Don't be shy.
It's time to talk about kidney disease. Bring in those pets. Let me take urine, please.